This is Insight and Beyond, brought to you by Moorfields Eye Hospital Dubai, a podcast where knowledge meets curiosity. World-leading experts in eye care will dive deep into the world of vision, health, and insights in innovation. Each episode is a step into the future of healthcare and more. Tune in, get inspired, and see the world differently.
Hello and welcome to another episode of Insight and Beyond. My name's Katie, I'm the Head of Education for Moorfields, and today I'm joined by Dr. Salma Yassine, our Paediatric ophthalmologist and Neuro-ophthalmologist here at Moorfields Eye Hospital. So as the children head back to school, I was wanting really to look into some of the eye health conditions that can really affect their academic achievement. Can you talk me through some of those things?
That's an excellent question. There are a lot of eye conditions that can affect the children's performance in academia and school. So that's why we always recommend to get their eyes checked before starting school. And the earlier we catch things, the better it is. So sometimes kids who are short-sighted, far-sighted, it can affect their concentration in school. They're focusing while doing homework or reading for a long time. Some kids, you think they're just lazy, but they just can't focus for a very long time because they're far-sighted. So it's very important to get their eyes checked before going to school.
And so what age would you suggest? So before secondary school or before primary school even?
Even before primary school. I usually like to start the first check between 1 to 2 years.
Okay.
And then yearly afterwards.
Okay.
So in the first check, we check if they need any glasses, we check for any squints, because all of that can affect their visual development.
I see. Would it make any difference if the parents say wore glasses? Would you change your protocol with checkups and things then?
There's definitely a genetic component to glasses. So if both parents wear glasses, there's a high risk that their children might need glasses. But still, they still need to be checked once a year, and I will still start between 1 to 2 years of age.
Okay, that's great. And then what sort of, if they did have a problem and they hadn't been checked, what kind of behaviours might you see in a child that has visual problems?
I always get asked this question. So they don't always show you that they need glasses. So that thing we have to keep in mind. Sometimes they think blurry vision is just normal because that's what they're used to. But sometimes there are a few signs like squinting to see, turning their head to certain positions that can aid their vision. So these are a few signs that the child needs to be checked as soon as possible.
And I guess, as you were saying, if children can't concentrate, they might be misconstrued as messing around or not, naughty children, rather than actually that there's something wrong with their vision. Okay. As we go back into the school year, are there sort of any eye conditions that you would be more aware of? Do you see more this time of year, or anything that you might look out for as we go back into the school year?
So one thing we've been seeing more often nowadays compared to a few years ago, pre-COVID, is short-sightedness or myopia. Because kids sit on screens for a long time, especially the iPad and phones. It pushes the eye to become more myopic. So that thing, I'm seeing it in very young children. The problem with myopia is that once it starts, it only gets worse. And if we catch it early, we do have a few things to help children control their short-sightedness so that it doesn't increase so rapidly.
Okay, that's really interesting. And again, on that, would you be putting children in glasses immediately? Because I know that some parents have a problem with, thinking that if you put them in their glasses, they'll become, reliant on their glasses. Is that a myth?
It is a myth, definitely a myth. They need their glasses. And if we don't give them glasses, they become myopic even faster.
Okay, so it can worsen the situation.
Exactly. And we even have special lenses for glasses that help children to control their short-sightedness optically.
Interesting. And obviously we mentioned there that there are more computer-based learning that happens. Are there any specific eye strain type of problems that you might get that goes alongside that as well with younger children or adolescents?
Yeah. Now, because as you said, everyone is using computers, even at schools, we are seeing something called digital eye strain. It happens when you focus at near for a very long time without giving your eyes a break. They can complain of pain, blurry vision, eye burning in the eye. So yes, so if someone has to sit on a computer for a long time, we need to take breaks. You have to apply that 20-20-20 rule. So every 20 minutes, you have to take a 20-second break and look at something 20 feet away, just to avoid the digital eye strain.
So certainly if our children are complaining of headaches and that sort of thing, it's absolutely essential that they come and get an eye test, because it could well be just something as simple as needing a pair of glasses.
That's true. So some kids who are farsighted, and when you focus that near for a long time, it can trigger the headache. So we have to rule that out.
Okay. And you were saying that it also makes myopia worse, potentially.
Yes. So near work, screens, even reading for a long time, it's the distance that matters. It pushes the eye to become myopic very quickly.
Parents really do have a hard time on their hands trying to get their children off their screens. Have you got any other advice as to how that might look, potentially using TV screens? Is that better than something that's close up?
Yes. So the farther away it is, the better. As you said, TV is better than phones and an iPad. And if you really have to use these devices, it should be at least arm distance away from the child.
Yeah, and I guess as well, just making sure that ergonomically they're not lying on a bed. They've got a proper desk set up so that they're not straining their necks and all
good
sorts.
Lighting also help with the eyesight.
Exactly. So certainly not reading with a torch at night under the bed covers.
Yeah.
So what would that do to somebody's eyesight? What
it causes
impact
strain,
would that?
though.
Okay.
It doesn't cause their eyes to become more myopic, but it makes them strain. They have to work extra to see better.
Okay. So proper lighting when children are reading, absolutely. If we were to order glasses for children, as you know, there's a lot of parents who are quite don't like the idea of their children wearing glasses. Are contact lenses an option for children? And if so, sort of what sort of age are we looking at for those children?
So contact lenses is definitely an option for children. My average is around 12 to 13, but it's really dependent on the maturity of the child. I always ask parents, do you think your child is mature enough to take care of the contact lenses? Because hygiene is so important. It can cause very bad infections if the child sleeps with the contact lenses, swims with the contact lenses. So I always ask the parents. Sometimes the child is 16 and I ask the parent, do you think it's okay? And they tell me no.
Yeah.
Some kids are 8, 9 and the parents tell me, yes, let's try it. They're mature enough. So it's really dependent on the child's maturity.
And what about their activities? So I guess if they are a bit more of an active child, if they're doing gymnastics to a high level, those sort of things would have an impact on your decision making for their care pathway?
Yes. If they are very active, are involved in a lot of sports, then yes, I would recommend the contact lenses. Except swimming, of course. You don't swim with the contact lenses on.
What would you suggest if a child has a strong prescription but needs to swim?
There are swimming goggles with prescription, actually, and there are sports goggles with prescription. So instead of wearing the glasses while playing, let's say, basketball and risk breaking them, there is a special goggle with a prescription, protects the eye and helps the child see well. And same goes for the swimming goggles.
Okay, that's really interesting. So there's always another option, essentially, for these children. Yeah. We need to just keep that in mind so that parents aren't put off, I guess, by bringing their children to us. Especially if they also, I think we have to remember now that glasses aren't the same as they used to be, sort of 20, 30 years ago, right? We have much better selection. They look nicer. I think especially those parents that grew up in the NHS in the 80s and 90s were used to some fairly awful looking glasses, which I think puts parents off. But I think now we really do have a much better array.
Yeah, especially for children. There are special brands that don't break so quickly and fit really well on their face.
And look nice, right?
Yeah,
they actually look
very
really good.
colorful. They can choose the colors that encourage them to wear it more often.
So as the children go back to school, there are children who do academically struggle a little bit, whether or not it be that they have some sort of neurodiversity or some learning difficulties or special needs. Would you have any different suggestions for those kind of children? Can we still assess them here at Moorfields, for example?
Yes, so they definitely need to get their eyes checked because sometimes not seeing well make them behave that way and can cause learning difficulties. So for sure they need to be checked. And we do have a special way of checking their eyes. It's not like the typical older children. So yes, we can tell the prescription, we can tell the health of the eye without even them saying anything.
Okay, so completely sort of objectively,
Exactly.
Right? That's amazing. And I would assume that the team have got special training in dealing with those kind of children as well.
We see a lot of these children.
Yeah, excellent. And I guess that would be one as well, where you may have a child with sensory needs who parents are worried that they won't keep their glasses on. But certainly from my experience, once they realise how much of a benefit those glasses are giving them, they wear them quite well, don't they?
They start asking for them.
Yeah, exactly. I mean, it's so interesting, the difference that you see often, and parents saying how much the behaviour has changed from pre and post glasses wear. So when should a child with any kind of special educational needs see a consultant? The moment they're diagnosed, would you suggest?
I mean, if they haven't been checked before, yes. I think that's one of the things you need to rule out. Because as you said, sometimes just giving them pair of glasses solves a lot of problems. They can focus better. They don't have any trouble with their education anymore. Some people are diagnosed with ADHD and autism, and they end up just need a pair of glasses. So definitely we need to get their eyes checked.
And then obviously as well, I think one of the other issues that a lot of parents have been facing is, because everybody's on these digital screens and whatnot now, there's a lot of noise around blue light and the effect of blue light on children. Is that something that you sort of advocate for in Moorfields, or is this something that is a little bit of a myth?
Definitely a myth.
Okay.
There is no studies that say blue light is harmful for the eye for us to prescribe blue light filter glasses. So I always tell parents you don't really have to pay extra for it, because I don't think it's very beneficial. Older kids may benefit from the sensitivity to light, but I don't think it's essential. I don't recommend it, to be honest.
Yeah, and we need blue light, right? It's helpful in our circadic rhythms to help us sleep and keeping our sleep patterns regulated. So potentially not the demon it's been made out to be, huh? Yeah.
The only thing I would recommend is not to use screens maybe 2 to 3 hours before going to bed.
Yeah.
Otherwise, it will mess up, as you said, the sleeping cycle, or just put it on sleeping mode.
Yeah, which is great advice. But again, trying to get children out of these habits, I think, is really quite a challenge for parents. And I've seen a lot of parents now talk about sort of phone baskets and things where they put all of their digital devices somewhere before they go to bed, so they can't be secretly looking on their phones at sort of midnight at night. For parents who are packing their school lunch boxes for their children as we head into the new school year, what sort of nutritional content foods, what's helpful for eye health, would you say?
That's a great question. Carrots are good, but they're not enough for
seeing in the dark.
So vitamin A, we need vitamin A, but we need all their vitamins as well. So eating carrots make your vision better is a myth. You need vitamin A, like you need vitamin B, vitamin E, vitamin C. You need all these vitamins to have good eye health. So if the child is a picky eater, then it's good to start them on multivitamins. But making him eat carrots just to have better vision, that's definitely a myth.
Pretty sure that's the only reason my children eat carrots, is because they think they can actually see in the dark because of the carrot eating. So I might continue that myth in my household. So just a varied diet, making sure they're getting lots of colourful fruit and vegetables. And you're saying it's more of a kind of preventative, protective.
Right. So you have to make sure they have a well-balanced meals, meat, vegetable, fruits. And again, if there are kids who are picky eaters, just make sure to supplement them with multivitamins. There are gummies that are multivitamins. So there are a lot of ways to introduce multivitamins in children's diet if they need it. Yeah,
that's great advice. Okay, so as we're now rolling into the next school year, if you could have a back to school pack with all your best advice for parents, what would that look like?
I would recommend that parents get their children checked right before going to school. If we advise to wear glasses, then encourage your children to wear glasses. Don't oppose it, because we are trying to help your child develop better vision. If your child has a squint and the doctor recommends surgery, have an open mind, because surgery helps them align their eyes better and also help them develop better vision and 3D vision. So definitely get their eyes checked before going to school, and continue to do that every single year.
Yeah, so even if you've prescribed glasses, they still need to have those checked, correct? Because as they grow, their prescription may change.
Of course.
So that goes across the board.
Yes, that's why we check them regularly.
That's really great advice. Thank you ever so much for joining us today.
Thank you for having me.
And that's the end of today's session. Thank you all for joining us.